Right, good afternoon, everybody. I'm Dr. Sam Hills. I'm the Clinical Director at Linton Lasers, and I'm absolutely delighted to introduce Mr. Ali Ghanem to talk about the rebirth of CO2. Mr. Ghanem is a multi-award winning plastic surgeon and an expert in regenerative medicine, has clinics in Bahrain, in London, the prestigious Cranley Clinic, and is going to talk to you today about perhaps one of my favorite laser treatments, which is CO2 treatments, specifically with the DECA Smart Side system. And I believe that you've not just got one, but you've got two smart sides.
Correct.
Brilliant. Well, I'm really, I can't wait to see what we've got here. But there is a Q&A function. Please do pop your questions in there, and we'll be back for a question and answer session at the end. Okay, Ali, over to you.
Thank you very much, Sam. So traditional laser treatments, and laser is very important tool in plastic surgery and in aesthetic medicine and in aesthetic and clinical dermatology. And it has not been there for a long time. Only maybe in the last 4 decades, we have started using laser effectively in medicine. However, the start of this journey was not straightforward. CO2 laser has had initially a very bumpy ride. So it was the laser beams directed at the skin with the powerful affinity to the water in the dermis, leading to full ablation of the epidermis, the papillary dermis, and sometimes full thickness burns. There was lots of complications initially, and now at the Cranley Clinic, I'm very honored to have Professor Nick Lowe as my senior partner associates. And Professor Lowe was at that forefront practitioners who used the CO2 laser at the early stages. And he was there to sort out lots of complications. And I tell you to be aware that some of my patients that I carried on treating 40 years later from the birth of CO2 laser have had their complications in the early 90s by the early pioneers of CO2 lasers in the UK, and I continue to help them 2 to 3 decades following their injuries. Also, there has been a huge downtime associated with Foley ablation and uncontrolled depth associated with the historical beginnings of CO2 laser. The procedure was very painful, continue to be very painful. Often my patients, even with the fractional CO2 laser indications, will stay in the clinic for several hours, around maybe an hour, putting 1 or 2 layers of strong local anesthesia, followed by some nerve blocks, followed by tumescent anesthesia. And then after that, we will have only like 15 or 20 minutes of treatment. So that because the treatment is painful, it's uncomfortable without this protocol of ensuring that the patient is comfortable. Sometimes sedation is needed. And as a result, there has been a restriction of who can do advanced laser resurfacing, and mostly that was refined or kind of confined with the practice of plastic surgeons, dermatologists, and it was not suitable for a long time to be done at the office. It was, a procedure left for the operating room. All that would make the procedure really expensive and beyond the reach of the majority of our patients. This is the kind of phase that the patient will go and have for 1 2 weeks or sometimes more than that. So in the 90s, there was an evolution in laser technology where instead of a continuous ray, there was a pulsed ray, which led to reduction in the destructive and kind of like potential risks associated with this treatment. However, that did not affect the long downtime, did not affect the painful treatment, and did not affect the risk of full thickness injuries continue to happen, which led to the following evolution in laser technology that is the fractional, computer-generated fractionation of the treatment, and that was the most important step that happened, you know, up to the new evolution that I'm going to talk to you about with the cool peel. You know, when this fractionation happened, the uptake of CO2 laser become wider, and there are like more control of the downtime, more control of the risks. Still, several weeks of erythema, post-inflammatory hyperpigmentation, and the painful nature of fractional laser continued to haunt aesthetic practitioners and reduced the uptake and the advantages of this great technology. You could see, in contrast of that, this is the new evolution. This is the reason why I'm telling you the rebirth of CO2 laser. We have a CO2 laser treatment of the entire face in this patient, and look how they look 24 hours later. Look how they look several days later. This is very similar to what our patients expect after a simple peel or radiofrequency microneedling or any other popular office-based procedures that not associated with the risks that I was talking to you about. And this is the beauty of having such a powerful treatment, you know, tamed to be friendly to the patients, less painful. I tell you what, this treatment does not require any local anesthesia, not even Embla cream, 4%. I'm very honored to have been the first practitioner in the UK to introduce the cool peel protocol through the Punto DECA. And, you know, I have been searching for a long time for a solution. I use erbium YAG laser, fully ablative and fractioner, and I use all sorts of lasers. And I have been in this search since I established the Queen Mary University of London Master in Aesthetic Medicine back in 2012. And finally, I have arrived at a solution that is enabling me to treat my patients, you know, without the downtime and without the risks. So what is a Smart Excite laser? This laser is just a label of DECA's highly versatile machine that can deliver CO2 laser both free-handed for surgical applications such as destruction of lesions or, you know, assistance of the surgeons in blepharoplasties or even the surgical scar, and also has a smart scan that can assist in resurfacing indications through a variety of innovative technologies that I will discuss with you. Now, for you to understand why there is a significant improvement of laser technologies, I must go back to the basics of what does a laser tissue interaction mean. When we aim a beam of CO2 laser at the skin, we can control this beam by several parameters. One important one of them is the power. So the stronger the beam, the more destruction there would be, and the deeper the drilling in the dermis will be. So the second aspect is the dwell time. So the dwell time means for the same power, we aim the beam at the tissue for variable time. And of course, the longer the time, also the larger the crater, the larger that defect that, you know, the laser will drill into the tissue, and the deeper, like in the power. However, a very important aspect associated with dwell time is the thermal effect, which is the area immediately next to the ablative area becoming coagulated or having, you know, kind of redness in it, having erythema. I don't know if you are familiar with the 3 zones of thermal injury. The necrotic zone is the ablative well, and then there is a zone of erythema, which is the farthest from the ablative zone. And in between, there is this kind of like zone of coagulation where part of the tissue has been kind of like damaged beyond the collagen denaturation points leading to contraction and potential contraction, and then some of it is a recovery kind of area. So with this area, this is the most variable area according to the time. So the longer we leave the time on for a specific power, the larger the thermal effect regardless of the ablative zone. So accordingly, historically, these are the only two variables that we were able to use to control different indications. DECA, however, introduced 3 more variables through which we can improve the outcome and control it further. So in relation of the advantages of smart Excite has been shown kind of in comparative research to be the most favorable technology among other brands. But I'm not going to kind of like refer to that. The literature is available to you. I'm going to focus on the scientific evolution and innovations associated with it. So we have a precise delivery due to the ability of changing from a free hand style to the computer generating fractional scan, the ability to treat very simple conditions to the most complex of conditions, surgical and non-surgical. It is hugely ergonomic, and it has multiple hand pieces for the surgeons to use for delicate small areas such as around the eyes and large areas such as like abdominoplasty. And finally, the rebirth of the concept of CO2 laser resurfacing through the cool peel that allow us to deliver the resurfacing with such a low downtime and such a comfort. We are able to accordingly treat different patients, different skin shape, different skin grades and shades, and finally we have like a myriad of surgical indications. Accordingly, we are able to reduce and predict complications and control the post-operative recovery, reducing the risk of infection, post-inflammatory hyperpigmentation or hypopigmentation, and also have great patient compliance in relation of the pain and comfort that allows us to kind of increase the patient compliance with the treatment. We can treat very superficial areas completely differently from areas that require deep treatments. We can suit and customize the treatment to suit each individual and each condition, and accordingly we have a huge reduction of the time of the treatment that makes it kind of like cost effective for the clinic and also for the patient. I think with the cool peel, laser can become every doctor's tool rather than confined to only dermatologists and plastic surgeon, maxillofacial surgeons. Now, it's very important that we discuss one of these innovations that the DECA has, which is the most important as far as the cool peel technology is concerned, which is the change of the pulse shape design. So historically, the pulse shape of the laser is like a chair where we have an initial peak that is associated with the ablative effect, and then a small peak, which is like a plateau at a variable time depending on the dwell time, which is responsible for the coagulation and the thermal effect. Now then there has been an evolution to kind of like make the initial peak more effective and then make the plateau, the thermal effect, less damaging, which is associated with the DECA pulse or DP. For that enables us to control the thermal effect to be confined to a deeper structure than the traditional smart pulse. So the smart pulse will be a superficial combined drilling and also a coagulation, where in the DP, it's a deeper level drilling and coagulation. So for example, when we want to target a superficial dermal lesion rather than epidermal lesion. And finally, we have the evolutionary high pulse HP, where we don't have the coagulative thermal plateau at all. We only have ablative peaks, meaning that we reduce hugely the downtime because of the zone of coagulation only is being used. And how is that? Is by reducing at a great level the dwell time. So in fact, in the HP, there is no recorded dwell time because so fast to kind of create any such concern. And you could see here a depiction on this. So you could see with the initial peak, there is the drilling, and the second plateau is associated with the thermal effect. And this is here the DP happening at a deeper level. And finally, you could see here how by drilling only without thermal effect, the HP is able to create the resurfacing without the erythema or the downtime. And these are summaries of the different characteristics of these SP, DP, and HP pulses. And these are the plateaus that can be controlled with the dwell time. However, with the ablation of the HP, there is no dwell time, allowing us to ablate only, significantly reducing the downtime and also the excitation of the tissue and the nerves. Therefore, it will be actually very, very low in pain. So you could see here that even histologically, these are different effect for the different pulse shapes. So for the same dwell time and for the same level of power or energy, we have different clinical and histological effect given different pulse shapes. You could see here with the DP, it's a deeper, even though that D is related to DECA, not deep. You can remember it as a deeper. You could see here how the shallow SP, so you can remember it as S instead of smart, like shallow. You could see that the ablation and the coagulation is confined to very superficial layer of the skin, and then with more energy, that ablation is larger and the coagulation is larger. Where in DP, we are now past the epidermis and the superficial dermis. We are really deeper, and then with more energy, we are able to get more deeper with larger coagulation. And that is true in a relationship of, kind of like the pulse shape. That's true and proportionate to the energy that can be increased. And accordingly, a patient like this one can be targeted with both superficial lines and deep lines to give this amazing result. The second innovation that DECA has is the delivery of the energy in a fractionation with time. So you are familiar with fractionation in space, where we are not using fully ablative laser to 100% of the skin, but rather we are fractioning this laser energy to anything between 5% to kind of 100%. Now we can deliver the same amount of energy in multiple pulses. And what does that do? It allows the tissue to recover between pulse 1 and pulse 2, leading to less thermal effect and less erythema and less excitement of the melanocytes, less downtime, but the same clinical effect. And by kind of giving a particular amount of energy, let's say we want to deliver 30 joules for a treatment area. By delivering it in 5 shots of 6 joules each, we will be able to fractionate that energy for the advantages mentioned. And you could see here that histologically this follows. So by each pulse, stack 1, it means only 1 pulse, stack 2, 2 pulses, stack 3, 3 pulses of the same amount of energy, we are able to drill deeper without increasing the coagulation zone. This is a little, this is a little cartoon to show you the concept of smart stacking with increased depth of treatment at no increase in the coagulation and the collateral damage associated with the ablation. And accordingly, we have full control of what we are able to achieve, from smoothing the edges of such like scar to really targeting the depth of the ice picks acne scars with great results. The scanner can be used as the freehand tool if you wishes, so you don't need to change the scanner for the freehand if you have a small lesion on the lip or the corner of the mouth or on the alar rim, but you can also use it as a freehand ablative tool and also as a skin scanner tool. And we have a different hand piece for precise incision, which is like the 1.5 inch hand piece that I used for blepharoplasty, or the 7-inch surgical piece that we can use for large incisions such as brachioplasty or abdominoplasty. And then we have the fractional scanner, which is depicted here. And accordingly, we will be able to use like the freestyle ablator to smooth the edge of the deep roller and box scars, and then use like the fractional scanner to kind of like ease the resurface, or use the smart scanner for the traditional resurfacing like in this example. Now, cool peel is the usage of the combination of the fractionation in time and space and the utilization of the HP to create a painless, comfortable, and low down resurfacing. So finally, I have to mention to you the third innovations associated with the DECA platforms, which is the way that the fractional laser will scan the skin. Traditionally, the scanning happen in a intercalated way. So, for example, if you see here this square, the ablation will happen, by going from right to left and then left to right and right to left, and that will lead to a heat zones where the laser will move, in a short time between two adjacent ablative zones. However, with the randomization of the smart tracking, you will see that the random pattern is generated by computer, and that will lead that the tissue can relax and cool between different fractional spots, leading to optimum outcome. So the cool peel combine all the innovations of the laser, allowing us, like here on the right hand side, to have such results with very, very little downtime without undermining or canceling the advantage that we used to have, such as the Madonna lift or the traditional CO2 laser resurfacing. That is why it has the highest satisfaction among any CO2 laser, in the public domain and social media, and allowing us to really combine surgical and non-surgical aesthetic indications in one tool, the DECA Smart Excite Punto. In addition to all that, we have the DECA Club, which is a library of articles, peer-reviewed comments, webinars, and instructional videos that the users of the SmartXide will have access to. And I really found that a great resource for my early learning curve.
So if you can see this lovely patient, but she has a lot of sun damage in her lower neck and the décolletage area. And that's a combination of tiny little vascular telangiectasia as well as pigmentation. You know that because when you blanch it, it improves partially. That's the telangiectasia, and then the pigment doesn't change. So the cool peel, it would be a great treatment for her. So we are going to do the face, we are going to do the neck and the décolletage using the cool peel protocol. So here we go. This is the punto, and then it is in my favorite. So cool peel level 1. It's a 3 watt power, spacing of 10%. I don't want her to kind of like have a longer downtime. It's sunny outside. And it is an HP pulse shape with the spray on. There is no dwell time because it's so fast. So there is no recorded dwell time in HP. And we are ready. We are going to use like no grid, a square, and spray mode. You know, we don't need to worry about the grid and the overlap demarcation. We are about to start. I'm going to change the square into a circle. You can choose any type. And I'm going to start from below. So this has been cleansed and dried. We have no makeup, and we are starting. First is a test shot. Is that okay? She is all right. So we are ready to go. So you need to be super vigilant so that you don't overlap. No local anesthesia, and she is really cooperating very well. Next time, in 4 to 6 weeks, we can increase the energy to 4 if necessary. But we start with the minimum downtime that is going to give us the desired effect. And you could see the erythema now being deciding the homogeneity of my treatment. Okay, so I'm going back and see the skipped lesions. So that's the cool peel for the décolletage, neck and the face without the need of the eye shields. We'll just give you a little bit of a facial. And very nice homogeneous erythema. We have very strong sun outside, so it's very important to put a thick layer of mineral sun protection after this. So the patient has been informed that she's going to have like sand paper feeling after 2-3 days, and she can use antihistamines or antihistamine cream to improve the itch if this happens, and she has to generously moisturize all the time. This is now sun protection. With tan sun protection, one can hide the erythema that is going to be relevant really for the first 48 hours only. After that, significantly reduced until like 3-4 days where the erythema ends, compared to other traditional CO2 laser where you have 1 to 2 weeks of erythema.
So as you have seen in the video, the cold peel is a straightforward, very fast procedure. And here I have treated the patient's décolletage, neck and face. And I tell you, historically, with my CO2 laser practice, I was never able to treat these 3 areas simply because if we put 23% lidocaine with 7% tetracaine on all these areas for half an hour, we might have some patients having an overdose and, you know, intoxication with lidocaine. So we were never able to treat these 3 large areas all at once. But now, without any local anesthesia required, I'm able to offer this to my patients, and they are able to have the advantage of having the different areas treated all at the same time. And you could see here, this is the same patient. And look how she has evolved over a 2-week period. So the 12th of June, you know, the following day, she was a little bit red. And then 2 days later, a little bit of redness around the eyes and some hint of redness on her forehead and neck. You know, the following day, 48 hours later, that continued to be prominent, but by 3 days, by 72 hours, this is no makeup, no camouflage. She is in a same color shade to her pre-procedure. And she continued to be like that up until 2 weeks and 3 weeks. And you could see at 3 weeks, you know, here it's not high resolution, but I will share with you my results at the end of the lecture with some real kind of VISIA results. But you could see that even at 1 or 2 weeks, some of the dyspigmentation on her, you know, kind of lateral face has been improved. This is another great area that I'm using the Smart Excite systems, especially the Punto and even the original Smart Excite, to improve the patient's outcome with upper lid blepharoplasty, even though that I have used it in the upper lid, the lower lid in excisional mode, but often I will use it in combination of excision and resurfacing mode.
Last one. Well done. I just need just 2 here. Just 2 to make it symmetrical pink. So sorry. 1. And then another one here, and that's done. Yeah. Perfect.
these are long-term results of some of the patients that I use this combination for. You could see here the great improvement in the upper lid, as well as the improvement in the quality of the skin in the lower lid that I used only one session of fractional resurfacing for. This is another example. You could see here the patient before. You could see the excess skin on the upper lid, the elimination of the tarsal show and the lateral hooding, and you could see the depth of the lines on the lower lid. You could see here at only 1 week, hardly any bruising of the upper lid, a little bit of erythema because of the CO2 laser effect. This is not cool peel. This is traditional CO2 laser with a dwell time of 800 microsecond and a density of 500 micrometer, giving us a density of around 13%. And you could see here 2 months later, much better aesthetic outcome. The tarsal show beautifully symmetrical, and she's able to go back and put her, you know, kind of like makeup, and the great improvement in the lower lid lines. And we can still use the Punto for the advanced practitioners. Tell you what, this is a very, very safe machine. So even if we kind of go to the maximum dial, which is 30 watt, 2000 microsecond, high density of 30%, it is still safe. However, you must warn your patient that they will have prolonged downtime, you know, in a traditional way, maybe 2 or 3 weeks of erythema, but the results will be so dramatic like in this case. And this is a fractional, not fully ablative laser. Equally here, look at the huge improvement in the perioral wrinkles. So the patient, if she wishes to have that addressed in one treatment, is possible by using high energy and low density treatment. You could see little still rosé, kind of like, but no pigmentation, no scarring, great results after 6 months. You can use this laser even with the most complex of skins with appropriate skin preparation. That's for another talk, but I often include, you know, tranexamic acid, hydroquinone or cysteamine, and the different concentrations of vitamin A and vitamin C in preparing my patient for aggressive lasers. But that is not necessary for the simple cool peel patients, which means you can offer them the treatment, you know, kind of like at a short notice. Such complex skin tones will require very long preparation. However, I have used the cool peel in up to Fitzpatrick type 5 patients without any skin preparation and without any post-inflammatory hyperpigmentation. We are still evaluating that, but I tell you, the results are very, very impressive. Even in difficult anatomical area, everybody knows, everybody uses CO2 laser knows that the neck lag behind the face. We have less stem cells in the neck per gram of tissue compared to the face, less vascular density network in the dermis. As a result, it's a poorer area to heal after CO2 laser, but still, even with high energy, such as 20 watt, 500 microsecond, we have great transformation, single treatment, 2 months later, all healed and well. This is my own patient that he required a lot of improvement. He expected improvement. He doesn't like Botox. He didn't want to use like fillers, and he only wanted regenerative approach. And I offered him a series of cool peels and fractional CO2 laser with the DECA, and look at this amazing transformation, you know, 4 months after course of 4 treatments. And he will continue to improve because collagen will continue to be deposited. And he is very, very happy with the improvement that he had. Look at his forehead, look at his lower lid, look at, you know, his cheek, zygomatic area, look at the improvement in skin quality in total. You know, he is really happy about that transformation that I am able to do now without prolonged downtime. You know, he's a banker, he cannot afford to have really a lot of downtime, and he had this, you know, coming either Friday evening or Thursday evening, and he was able to go to the office by Monday. And look at the improvement of the sebaceous skin on his nose. Look how smooth and nice his nose tip looks now after these series of treatments. So that concludes my introduction and my great excitement about the rebirth of CO2 laser. I hope that you have found these insights useful. You know, I'm really very happy with the system, which has totally transformed my practice in relation of, you know, the comfort and the confidence that I can use the tool. And my doors are open for all of you. Please come. You know, you are welcome to come and see some of what I do. Or you can contact Linton, who will be able to book, you know, clinical demonstrations with you. For the time being, I'm very happy to take questions.